The dietary management of urolithiasis in dogs and cats. So the presence of urinary crystals or crystalluria or large concentrations in uroliths or coculi within the bladder or lower urinary tract. The prevalence is 10% in cats and less than 3% in dogs. It's due to decreased water intake and increased protein intake. So in felines, urolithiasis belongs to a manifestation of several lower urinary tract disorders, collectively known as FLUT, so FLUD or feline lower UT disease. In dogs and canines, more commonly associated with lower urinary tract infections. It's very important to note that the mineral composition of the urolith, so you can have the appropriate treatment. So more than 80% in dogs and cats are either co-oxalate or struvite. In 90% of uroliths in cats, it's composed of struvites. So the background is a struvite is stonocrystal. It's formed by an alkaline pH, most often in the bladder. It can cause an obstruction, straining pain, and can cause renal failure or septicemia and death. It can be diagnosed through ultrasound, X-ray, or relative supersaturation. The risk factors are increased urolithiasis, struvites, the urine pH. The alkaline pH has to be more than 8. This is a risk of urolith formation, and it may be due to vomiting, which causes acid loss, and hyperventilation, which causes CO2 loss. The urine protein excretion properties, so high magnesium and high potassium, they both cause struvite. So high magnesium is normally quite low in the dietary, but high phosphate is usually high enough in normal cases. Then you have high calcium and high chlorine, calcium oxalate and calcium phosphate and calcium carbonate. Low moisture content, the feeding regime, and the dietary interventions of struvite stones. So meat products in cats contribute to the production of more acidic urine, and salt compilations, so increase the polydipsia and polyuria, and they also increase renal excretion in the cases of calcium in cats. And urine acidifiers are needed, and special diets with acidifying effect, such as decreased magnesium, phosphorus and proteins, and increased water and sodium. So acidosis and sodium. So severe CDK leads to metabolic acidosis, and then you can have diseased kidneys at poor regulating sodium, and excess sodium leads to water retention, and lack of sodium leads to dehydration. Potassium. Hypokalemia is due to increased loss and appetite, a decreased appetite, and then hypokalemia is more common in felines than in dogs, and hypokalemia is more painful in the muscles and weakness. The treatment is potassium gluconate and citrate orally. Water and vitamins. So polyuria leads to dehydration, and these vitamins are lost. Drink plenty of water and supplement. And glomerulonephritis, the treatment is low protein, low sodium, decrease hypertension, and maintain the blood urea level.